This is Scully. He's a skeleton that is learning about himself. He feels very sad and angry because he doesn't know how he works and he doesn't understand what is being taught. To help him understand what is happening, he's starring in a video teaching him a little bit more about himself. First, Scully is going to learn about the structure of the skeletal system. The skeleton is composed of four main fibrous and mineralized connective tissues: bones, ligaments, tendons, and joints. Bones are classified by shape: long, short, flat, irregular, and sesamoid. Infants are born with about 300 separate bones. Then, as a child grows, some of these bones fuse together until growth stops, typically by the age of 25, leaving the skeleton with 206 bones.
That's a lot of bones. Human bones are filled with blood vessels and bone marrow. There are some variations between male and female skeletons. The female pelvis is typically more broad, thin, and round than the male pelvis. There are two categories based on purpose and location: axial and appendicular, but we'll talk about that later. Three main types of materials make up every bone in your body: osteoblasts, osteocytes, osteoclasts, and lining cells. Osteoblasts are bone cells that help repair existing bone material as bones break or get damaged. Ligaments connect the ends of bones together to make a joint, such as your elbow or knee. Tendons are fibrous tissue that connect muscle to bone. The four main connective tissues work together to make sure that but certain diseases can occur to the skeletal system, such as osteoporosis, a disease that causes bone strength and density to decrease, or osteoarthritis, a disease that causes the cartilage to wear down. Now let's move on to the function of the skeletal system.
The main function of the skeletal system is that it provides a framework to the body and provides shape. The shape plays a role in the overall function and mechanics of the human skeleton. The various shapes and sizes allow the body to move and operate in certain ways when you're doing something like as your body begins to grow and develop, your bones will begin to fuse together in order to match up to your size so that your movements and actions are even. Previously mentioned, there are two categories of the skeletal structure: the axial and appendicular. The axial skeleton supports and protects the brain, spinal cord, and many of the internal organs. It also provides sites for the attachment of other bones and muscles in the body and protects the nerves and blood vessels from the brain and spinal cord. The appendicular skeleton is composed of the bones of the upper limbs, which function to grasp and manipulate objects, and the lower limbs, which permit locomotion. The connective tissues in the skeleton, bones, joints, ligaments, and tendons, are a part of these two systems and serve to allow the body to maneuver in certain ways and manipulate itself to perform detailed and intricate movements such as writing. Not only does the skeletal system allow you to actually move around, but it serves as a protective layer of your organs. It keeps the organs safe and in place and prevents them from any damage.
Finally, let's move on to parts of the skeletal system. The organs in the skeletal system are known as bones, and there are 206 bones in the skeletal system. However, we're only going to go over a few main ones that are the most important to know. The first bone we're going to talk about is the humerus. This is the long bone of the upper arm. The two bones that make up the lower part of the arm are the radius, which is found on the thumb side, and the ulna, which is found on the... Going further down on the arm are the carpals, which are a group of 8 bones found in the wrist area. Finally, there are 14 phalanges that make up the fingers on the hand. Let's go down to the leg area. The femur is the largest bone of the upper body, and the largest bone in the body. The tibia is the main bone of the lower leg that forms the shin. These are some of the main bones in the skeletal system. There are more, but for time's sake, let's think of these as some of the most important ones. The first part we're going to talk about is the ligaments and joints. Ligaments and joints are made of fibrous collagen tissue that attaches one bone to another. Ligaments and joints allow the bone to move in a particular direction and enhances the movement of body parts. The next important part in the skeletal system is the tendons. These are very important parts in the skeletal system because they join the muscles in the system to the bones. Tendons tend to be very flexible, but excessive flexibility of tendons make them more prone to injuries and infections. The final part of the skeletal system is cartilage. Cartilage plays a role in maintaining and forming the shape of the human ear and nose, as well as other organs. Cartilage also protects bones against friction and wear. Now that Scully knows about himself and the skeletal system, he is very happy.